Sudah kenyang?
Terima kasih.
So my name is Ashwin, and today I'm going to be talking a little bit about photobiomodulation therapy. So that is essentially what Vantro's IM laser device is about. So I'm from Penang essentially, and I have a clinic in Island Glades. I run a practice with my father there, and the clinic has been there for about 30 years now. So we have been involved in photobiomodulation therapy for about a few years now, but previously the devices that have been used were very big devices, costing about $15,000 to $20,000, and technology, I wouldn't say anywhere as advanced as the IM laser device. So this technology has been around from Russia, from Germany, from China, but now what you guys have is actually something which is very interesting and very different. So I'm going to be talking about it and just give you some explanation about it so you have a good understanding about what you're using. Is that okay?
Yes.
Okay. So this is a big word to pronounce, photobiomodulation therapy. I prefer hands-free, easier. Okay, so photobiomodulation therapy, from the word itself, it explains what this cold laser or cold light therapy is about. Photobiomodulation, photo means light, and biomodulation means bio is the cell and modulation means changing the cell. So this is actually using light to change the cell. So it's using a non-ionizing light source, which can either be laser, LED, or broad spectrum. IM laser is using diode base, which is actually more powerful than the LED. So these are the lasers that we are familiar with when we watch movies and we see laser lights and all these kind of things. But this is using a different spectrum. So this is in the electromagnetic spectrum, which is known as the visible light spectrum, between 400 to 700 nanometer. The IM laser uses a specific wavelength, which is 65 or 650 nanometer, or near infrared. It's just close to near infrared. So we have radio, TV, microwave, X-ray, all they use different wavelength frequency. So you can see the frequency is somewhere around here. The orange zone is the 650 nanometer. Why they use 650 nanometer is because multiple clinical study and research over many years, they have actually found out that this range, this frequency is actually very therapeutic, very beneficial for us to get a health benefit from this. So this technology to us is something that is quite new, but actually it has been around for some time already. In fact, one of the first people to come up with this science behind this technology is none other than Albert Einstein, and that was in the 1920s. So that is almost about 100 years ago. And Albert Einstein, he created a therapy, a scientific understanding using physics, and he found out that using this technology you can actually get health benefit. Then about 1960s, it started to get more and more in-depth in the research. So the process is something to do with something in our cells. We have a few trillion cells in our body, something like about 20 to 30 trillion cells in our body, every one of us. And in each cell, there is a nucleus, which is the center of the cell, and then there's the mitochondria. The mitochondria is something like the ECU. The car has the ECU. So inside each cell, there's a mitochondria. And inside that mitochondria is something called ATP, adenosine triphosphate. So in that adenosine triphosphate, when the laser light enters and penetrates into our body, it will stimulate something called cytochrome C. And the cytochrome C absorbs this light and will stimulate the mitochondria to produce ATP. The ATP is a very interesting process because a lot of anti-aging and all the disease processes that occur in our body, when we compare ourselves from our 20s to our 30s and 40s, the aging process that occur on an external basis and on an internal basis actually is occurring because of the ATP. The ATP holds a lot of DNA, and inside this DNA is the key to a lot of our aging processes and disease and illness. So a lot of new technologies nowadays are actually going into ATP, into mitochondria to understand this technology further and to stimulate it. For example, Singapore, they have spent something like about 80 million Sing this year in research on cellular technology because they understand that this is the way forward. And they understand that there is something to do with the cells. When they can treat the cells, they can actually treat the person as a whole. So this is a little bit more complex explanation about how when inside the ATP is stimulated, then it will dissociate something called nitric oxide, and this will allow respiration. Respiration is we have respiration like how we breathe, but also in each of our cells we have something called cellular respiration, and that is for the cell to function at a good level. So the cellular respiration can work properly when the nitric oxide is dissociated, and something called reactive oxygen species, otherwise known as free radical, is moved away. So that is something like a detox process. So when we detox the cell, we are actually stimulating the cell to be functioning at a better capacity. Anybody got headache? It's a lot of information. But just to make it simplified, all this means that it speeds up the healing and wound repair. So people who have a diabetic foot ulcer, for example, it should be able to help it. Reduce swelling and inflammation. Some people have leg swelling and they have inflammation, and it increases blood supply and oxygen to the vital organs, and it removes toxins and waste. So these are a few different pathways by which the cold laser can benefit a person. It can work through the blood vessel, and it can promote increase of blood supply. It can increase collagen production. A lot of people who go to the beauty salon, they've heard of collagen, I'm sure. So collagen is on our skin, so it can help to improve the skin. So you can use the applicator for the face, and that can help to stimulate the collagen production. And it can also help, collagen production is also necessary to reduce inflammation. So a lot of allergy problems, skin problems are related to collagen production, and wound healing is also related to collagen production. Then muscle regeneration and muscle atrophy. As we age, our muscles start to get smaller and smaller. If you compare some people who are in their 30s to their 60s, they might notice their arms or their legs are getting smaller. So that is called muscle atrophy. So it can help to stimulate and regenerate these muscles. It can even work to the depth of the bone. I have used it for some patients who have bone infection and have got a good result. Bone infection where they have been taking antibiotic for 1 year and still cannot get any treatment. And they have used the device in under 2 weeks, they have got results. Then cartilage, it helps for the cartilage, nerve regeneration, and inflammation and edema. So this is generally the process. It stimulates the cytochrome C inside the mitochondria to produce the ATP that stimulates the nitric oxide, and that reduces the pain, inflammation, and repairs the cells. So generally it is using oxygen. If you want to understand the concept, you just think about oxygen and feeding oxygen to our cells, and that's how the cells start to repair, and increasing blood supply. As we get older, our blood supply start to shrink, get hardened because of cholesterol and other reasons, aging factor. So it helps to increase the blood supply. For example, when we go exercising, if somebody who hasn't exercised for many years, their blood supply is actually reduced to their organs. Then when they start exercising on a regular basis, they create new branches like a tree. It needs to create new branches. We create new branches to increase our blood supply to a particular organ like the kidney, pancreas, heart. So this is one of the benefits of exercise. So this is what is known as cellular therapy or cellular technology. So now medicine has changed quite a bit from previously giving invasive treatments or externally consuming pills and tablets to recover. Now medicine is more focused on treating and healing from within, from inside the cell, and more on a preventive scale, trying to prevent disease. A lot of us, like for example, you see a healthy, fit person, going for jogging. And you think, why does the person need to go for jogging? They're already healthy and fit. But actually, it's the maintenance of health which is important. So the benefit of cold laser therapy is actually, it is also for preventive. So in the future, once more and more people have the awareness of cold laser therapy, they can start to use it on a preventive benefit rather than just on a therapeutic benefit. Meaning to say that healthy people who don't have any illness can use it to maintain their health. Of course, there's other factors also in diet, sleep, and exercise that you have to do simultaneously to get a good result. And that will help on the overall picture for maintenance of health. And this will help to, for example, if somebody is going to get high blood pressure at the age of 35 or 40, it can help to prolong that to a later point. So now we are surrounded by a lot of what we call 21st century disease, which previously we did not have, like high blood pressure, diabetes, high cholesterol, and now a lot of us are familiar with cancer also being very common nowadays. So this is actually all related to cellular dysfunction. Our body is accumulating toxins inside, and these toxins, they cannot clear off fast enough. Our body is not detoxing fast enough, and because of the stress factor, the poor sleep, all the things that people are experiencing in this generation, the poor diet, so this is contributing. So what we need is something to cleanse our system from internal, to clean out the cells, to detox the cells. So all of us are essentially made up of cells. Cell is like the atom, we learn in physics, the atom. So cell will become a tissue, multiple cells become a tissue, multiple tissues become an organ, multiple organs become a system, like a cardiovascular system, a respiratory system, all individually become a system, and then systems collectively become the whole human body. So the key is actually in the ATP. The ATP is about 1,000 to 2,000 mitochondria per cell, and this is a very high ROI. For example, in the mitochondria, there's a process called the Krebs cycle or TCA cycle. That process, one ATP, after completion of that whole cycle, can give 8 ATP. So it's such a fantastic phenomenon that we can actually create from one ATP cell. After going through this cycle in the mitochondria, it can produce 8 ATP. That means the return of interest is better than any stock market. So this is essentially how a cell looks like. And our body is made up of these cells. There's a nucleus in the center, and all these mitochondria which contain the ATP inside. This is how the mitochondria look like. And all these things inside the mitochondria that contain our DNA information and give us energy, it comes from here. So there's something called antioxidant. Now we have come across a lot of terms when we go to pharmacy or we hear on the radio or read in the newspaper, antioxidant this, antioxidant that. What is antioxidant? Antioxidant is so-called the good guys. We need a lot of antioxidant like vitamin C, glutathione, vitamin E. They are all high in antioxidant. Antioxidant is actually what prevents our body from going through internal stress. So the opposite of antioxidant is free radical. Free radical is what causes a lot of disease, including cancer, high blood pressure, diabetes. All these conditions, even autoimmune conditions, are all linked to free radical damage or oxidative stress, the stress within the cell that leads to problems. So the antioxidant and free radical balance has to be good. Antioxidant level has to be on the high side, and free radical has to be on the low side. So all the things I mentioned to maintain a healthy lifestyle is what will help to keep that balance going. So this is a cartoon depiction of the good versus the bad. So free radical, they have done a lot of research for many years and link it to a lot of disease and aging. So they are basically unstable molecules. So this is a picture of how the free radical is. The free radical is this one here, is unstable and it lacks an electron. So it goes around damaging cells and then causing cancer and other health conditions by trying to get one more electron from the other cells. And then it tries to get atom from a healthy cell, and makes that cell into unhealthy. So it becomes a process. They get more and more. The antioxidant, on the other hand, if their body has a lot of antioxidant inside, it can help to donate an atom or electron to the free radical and stabilize it. So that is one of the benefit of cold laser therapy. It actually creates higher antioxidant in our body, and this will help to reduce the free radical load. This is a picture of how a free radical look like. So this causes damage to the mitochondria. Free radical over time start to damage the mitochondria. That will damage the body's cell function. The cell cannot function properly, and that start to lead to a lot of disease and illness. Make sense so far?
Yes.
Yeah.
So free radical can damage almost any. This is very important slide actually. This one shows how the free radical can cause a lot of oxidation stress in our body. And if you see, it can link to almost any condition that we are facing right now is linked to free radical stress. So if we can create a balance for this free radical, it is actually what we can help to improve our health. So you can see from autoimmune condition to diabetes to acne to HIV, herpes, cancer, asthma, eye problems, and even heart disease. So these are the common factors that will help to worsen our health and aggravate the production of more free radicals. So unhealthy diet, high in carbohydrates, high in oily fried foods, smoking, either actively smoking or in inhaling secondary smoke, high amounts of stress, work stress, family stress, husband or wife stress, lifestyle which is quite sedentary, lack of sleep also. Lack of sleep is a very big issue nowadays. A lot of people facing lack of sleep. So all this will increase free radicals in our body, reduce the antioxidant. So we want high antioxidant, low free radical. So the ATP reduces free radical. ATP reduces free radical in the body by increasing oxygen. So a lot of new age supplement, new age technology, they are focusing on ATP and trying to reduce and minimize free radical. So using cold laser therapy, you can reduce the amount of free radical, increase the ATP and oxygen in our body. Wow. This is an interesting picture, how from 30 to 100 years, we can see the changes, the eyes, the face, the skin, the hair, all these changes that happen. These are the visible changes that happen on a surface level. But this is actually also happening on an internal level within our cell, which we cannot visualize. Sometimes you can do maybe a blood test and you can see some changes, but on a cellular level, this is what is happening. That's why the cells are contributing to the whole body having this appearance. So we can actually help to reduce this process and slow it down. Cannot stop, but we can actually help to slow it down, and by reducing the free radical load, by reducing the oxidative stress, increasing the antioxidants. So this is what is oxidation. Oxidation means this is oxidized. This is oxidized, and this is undergoing free radical change, and this is not oxidized. So this is the difference that is also can be appreciated on a cellular level. Okay, thank you very much. I hope you enjoyed the talk.